So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is correct, and after, let's discuss this test step by step. So it's 45-year-old man. His major complaints is fatigue, knee pain, and morning stiffness in his hands that lasts for hours. And prolonged morning stiffness tell us about inflammatory arthropathy. He takes acetaminophen, which is also called paracetamol. Once we see acetaminophen, we always keep in mind that it's extremely hepatotoxic drug. He also has swelling and tenderness in his wrist and metacarpophalangeal joints. So there is definitely some inflammatory arthropathy. His hemoglobin is 92, which is low. Decrease in hemoglobin we call anemia, and we know that anemia classified based on severity and the size of red blood cells. To determine severity of anemia, we have to know two numbers. It's 110 and 80. Also in this case it's a man, and the lower limit of normal of hemoglobin in men is 130. So from 130 to 110 is mild anemia, from 110 to 80 moderate, and lower than 80 is severe. In this case, hemoglobin is 92, so it's moderate anemia. The type of anemia we determine by the size of red blood cells. And to determine the size of red blood cells, we look at MCV. In case of MCV, we have to know two numbers. It's 100 and 80. Everything about 100 is macrocytic, between 100 and 80 normocytic, and lower than 80 is microcytic. In this case, MCV is 65, which is microcytic anemia. So in this case, patient has moderate microcytic anemia. Once we see microcytic anemia, there are four anemias that come to mind. It's iron deficiency anemia, anemia of chronic disease, sideroblastic anemia, and thalassemia. What we also know is that he has low serum iron, and there are two most common microcytic anemia with low serum iron. It's iron deficiency and anemia of chronic disease. They both have low serum iron, but the key difference between them is that in iron deficiency anemia, ferritin is low and transferrin is elevated, and in anemia of chronic disease, ferritin is elevated and transferrin is low. In this case, we know that patient has elevated ferritin, which is a feature of anemia of chronic disease. From his complaints, we see knee pain, morning stiffness, and swelling and tenderness in his wrist and metacarpophalangeal joints, which are the features of inflammatory arthropathy. In this case, most likely it's rheumatoid arthritis. To explain how rheumatoid arthritis leads to anemia of chronic disease, recall that in the iron panel we have ferritin, which is the iron depot, transferrin, which is a molecule which transports iron, serum iron, from which we make a hemoglobin, and dietary iron, which we consume. After we consume iron, transferrin binds iron and deliver most of iron molecules to ferritin, and from ferritin we take iron to make hemoglobin for red blood cells. Rheumatoid arthritis causes massive production of pro-inflammatory cytokines, which block the transportation of iron molecules from ferritin to serum iron. As a result, ferritin increases and serum iron decreases, which causes anemia. To treat anemia of chronic disease, we have to remove the causative factor, which is rheumatoid arthritis. So in this case, to treat anemia, we have to treat rheumatoid arthritis, and to treat rheumatoid arthritis, we have to prescribe methotrexate. with decrease in activity of rheumatoid arthritis, the production of pro-inflammatory cytokine decreases. This causes normalization of serum ferritin and serum iron, which corrects the anemia. So the right answer here is methotrexate. Erythropoietin also can be used for treatment of anemia of chronic disease, but it's a symptomatic treatment. It won't remove the cause, and because of this, it won't solve the problem.